let's get 2 minutes on the clock and your time starts now. All right, time is up. Let's get to some answers then. So this is a case of trigeminal neuralgia. It's got that characteristic severe, sharp, intermittent facial pain, often triggered by chewing, brushing teeth, or similar kind of activities. There are a lot of other things that can go along with that as well, and some of the more common things are going to be TMJ dysfunction, temporomandibular joint dysfunction. For the exam itself, yes, you're going to have to spell that out. Remember, we're not using any abbreviations. And look, as long as you're vaguely getting a combination of letters in order that can vaguely spell that out, I know I would not be able to spell that out in the middle of an exam, but give it your best shot and they will take that into consideration. They're not sticklers for spelling, but they will lose you marks if you put in a abbreviation. Of course, this can also be dental pain. Yeah, it's probably less likely in this setting, but dental stuff is hard, which is why it's its own full profession, and so just on face value here, there's not enough information to definitively exclude it, even though there's hints away from it, and so it still would be an accepted differential. This could be maxillary sinusitis or sinusitis. Again, we get you some marks, and the ones we wouldn't want you to miss here would be things like a giant cell arteritis or temporal arteritis. Of course, this can also be much less likely, but I think you still would scrape a mark in if you really had to. Things like a first presentation of multiple sclerosis, remembering that you can have all kinds of weird and wonderful things that actually give you that first manifestation. Of course, if we're going for the big bucks, hopefully you've got trigeminal neuralgia here, and of course that might lead into perhaps the next question. So, let's get 2 minutes on the clock, and your time starts now. All right, time is up, and let's have a look at some answers here. This one's intentionally a little bit tricky because, as most of you are probably aware, trigeminal neuralgia often has 0 findings to investigation. But with this question here asking what are appropriate to confirm the most likely diagnosis, that then puts us onto a path of excluding the other big ticket items that could be there. Of course, best bang for buck is going to be an MRI of the brain. With this, we're going to be able to exclude things like multiple sclerosis, as well as looking for things like swelling of the superior cerebellar artery, SCA, which is commonly what actually compresses the nerves, which gives you the trigeminal neuralgia symptoms. And so that's definitely going to be worth more marks than anything else. Of course, we didn't definitively exclude dental abscess, and so dental X-ray or OPG would also be accepted. Or serum erythrocyte sedimentation rate, or CRP, either one of those, not both, would get you an extra mark there because we're excluding conditions such as giant cell arteritis. Of course, if this is something that you're not feeling as comfortable with, these answers came from Facial Pain, a diagnostic challenge from AFP. Definitely worth a read if this is something that you perhaps didn't feel as comfortable about. Has an awesome overview of each of these conditions. Okay. So, of course, we've got one last question on this case. Let's get 2 minutes on the clock and your time starts now. All right, time is up, and let's have a look at some answers here. And of course, this is a question that has come up before, and surprise, surprise, it will come up again. You'll find these kinds of questions can be repeated time and time again in exams, so common things are common. We should know them pretty well. Of course, the big ticket items we want to be warning patients about for infusions is allergy, or in particular anaphylaxis. Specifying either of those is going to get you marks. Anytime we're bypassing the body's normal defense systems, we have to be very mindful of big allergic reactions and allergic responses. Next big thing that is one that I think a lot of people actually forget about is hypophosphatemia. Important not to miss because one, sadly, it's common. Two, it can be very serious. And so you need to be warning patients about the fact that as the body consumes the iron and uses up the iron from the iron infusion, it's also going to use up a lot of the body's phosphate. If that gets too low, they can actually become quite unwell. They can become confused. They can have unusual neurological symptoms, even seizures, coma, and death. Death is obviously pretty rare, but given this is something that's really easy to fix, why not fix it? And something as simple as a can of soft drink, a can of carbonated drink will do the job. They just have to drink one of those a day for a week or so after the infusion. Job is done. Can be diet stuff, go for it. But just something that has that phosphate, that effervescence in there does the trick. We used to, I'm going to tangent for a second here, bear with me. We used to recommend things like fruit tingles, the little kind of lifesaver things that would effervesce in your mouth, but they changed the formula on it, and so that doesn't work anymore. They don't actually have the phosphate there. So sad. Anyway, of course, myalgias or joint or muscle pains also incredibly common and so important to warn the patient about. Not dangerous, not harmful, just uncomfortable, and so because of that, need to warn. Staining of the skin due to extravasation is something that doesn't happen very often, but is something that can happen and can be permanent. It can be incredibly difficult to remove, to treat, and so is something you would definitely want to warn a patient about. Particularly, a relatively young woman who may be quite concerned about cosmetic appearance. Now, I've put in here as well as a good example here, staining of the skin due to extravasations, 2 marks, skin staining, 1 mark. You really need to have that specificity in your answers, showing that not only you know what the complication is, but why, what has to happen for that to occur. You've also got your generic headache, dizziness, nausea, things that you can kind of throw into any of these kinds of questions, to be honest. You can have transient changes in blood pressure, can be high or low immediately after the infusion. You can have flushing after the infusion. I'd kind of lump those together. Again, your generic stuff, things like infection at the cannulation site. In this case, I wouldn't count things like bleeding at cannulation site because, let's be honest, there's not going to be a significant bleed from the cannula site unless something has gone horribly, horribly wrong. I don't think that's a particular thing that would be specific to this kind of thing, and this question is asking about specific risks.